Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. As we go into the weekend, please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 118,561 confirmed cases of COVID-19 in Canada and 39,809 cases in Ontario. Chatham-Kent has 308 cases and Sarnia-Lambton has reported 319 cases. Michigan now has 85,429 cases, with 12,888 cases being in Detroit. Today, we are reporting 2,357 cases of COVID-19 in our community, an increase of 1 case from yesterday. The person works in the agri-farm sector. 222 of our cases are currently active and are being followed by our health unit. 2,064 cases have now resolved. 206 people are self-isolating, and 10 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39. 65% are male, and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 1 retirement home is experiencing a COVID outbreak. In addition, there are currently 13 workplace outbreaks. 6 are in the agriculture sector, 6 are in the manufacturing sector, and 1 is a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you are feeling confused or losing consciousness. Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington, and Windsor Regional Hospital Ouellette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for the weekly EPI summary.
Good morning, everyone, and thank you for joining us again today for the epidemiological summary. I'll just dive right into it. I have a lot of slides to cover. So very quickly, this is what we will going to cover today, and many of the questions that we have been asking around and any new information that we like to share with the community, we always try and put it up in our EPI summary, and we'll try to touch on each of these components as we go along. So starting with the EPI curve helps us assess the progression of the disease, whether in the community or in an outbreak situation. And this particular EPI curve is created to show the number of confirmed cases by the date it was reported to the public health. On your vertical axis, you have the number of confirmed cases, and on your horizontal axis, we have the dates these cases are reported to the public health. This figure includes all cases, that is cases in the community, cases in the long-term care home and retirement home, and also cases in the agriculture farm sector. Day-to-day variation can vary significantly, and we know COVID-19 do not cause disease after exposure immediately, and in order to minimize the impact of day-to-day variation, another way to look at it is to use a 3-day moving average. The 3-day moving average should capture day-to-day variation, and we'll try to present a much better picture of how things are progressing in our community. We had our first case in the 3rd week of March. Since then, our cases stayed relatively stable and started to trend down around end of April. We saw a significant uptick around mid of June that persisted up until more recently, and thanks to all the residents of Windsor and Essex, the trend is now moving in the right direction. Please keep doing what you're doing to reduce any COVID transmission in the community. Stay home when you're sick. Always maintain physical distancing of 2 meters or more, and wear cloth masks if physical distancing cannot be maintained. Breaking down our further epi curve by agriculture farms versus non-agri-farm sectors by reported date. And the majority of our cases, what we have seen more recently, have been in the agri-farm sector. However, we have seen some increase in the cases acquired outside of this sector in the recent weeks. Overall, what we have noticed in the past week is both the cases in the community as well as in the agri-farm sector have been decreasing. This particular graph looks at the cases that presents to our emergency department at Windsor Regional Hospital and Erie Shores Healthcare with symptoms that are related to COVID-19, such as cough, fever, pneumonia, and others. The green line is the current 2019-2020 season, which starts in September 2019 and goes all the way up until the end of August 2020. We are currently in week 31. The blue line is the 2018 and 2019 season as a comparator. As we have seen in the previous presentation, we saw a high number of cases in March to May related to symptoms of COVID and people presenting to the emergency department, but it has decreased since then with a recent uptick in the last 2 weeks, mainly from in one of the hospitals. And breaking it down further by the hospitals and looking at what happened at the Erie Shores Healthcare, we don't see the same trend. In the last few weeks, we have seen a significant number of cases coming to the emergency department with symptoms that are compatible to COVID, but has decreased this week so far. This figures look at the number of unique individuals tested per day and whether their lab results turned positive in Windsor-Essex and all of Ontario. Individuals tested multiple times on different days are still counted at once in each week's count they were tested for. In the middle of March to mid-April, the number of individuals returning as positive was between 13% to 22%. This was higher to what was seen in all of Ontario. Currently, between July 26 July 26 to August 1st, roughly around close to 2% of individuals in Windsor-Essex are testing positive compared to overall Ontario, where the testing percent positivity was close to 0.4%. During this same time period, on an average, 806 tests were completed daily, and 798 people were tested daily in Windsor-Essex. As of August 3rd, a little over 65,000 tests were completed across Windsor-Essex, with 45,000 unique individuals were tested in Windsor-Essex. The overall percent positivity since the beginning of this pandemic among all tests conducted from March all the way up to last week is 3.7%, and among people that were tested was close to 4%. Please note that the most recent week, the information might not be complete due to reporting lags with the lab. One of the common method of looking at how we are doing is also using a 7-day moving average to look at our overall trend. The blue line looks at all of our cases using a 7-day moving average. We see a peak in late March and in April, the latter attributed to the outbreaks in long-term care home and retirement home. Currently, we saw a sharp decline in the last week or so with our 7-day moving average. The green line looks at the 7-day moving average if we were to remove the workers in the agri-farm sector. You will notice that the 7-day moving average declines dramatically from May onwards when we exclude agri-farm sector. However, in the month of July, we have seen an increase in the 7-day moving average of cases outside the agri-farm sector. We were stabilized to about 5 cases a day in May and June from the community, but we have seen 15 cases per day in the community in most part of July. Right now, we are seeing 7 cases per day in the community using the 7-day moving average. The slides capture the week-over-week incidence rate per 100,000 population from week 18 to our current week, which is week 32. We have seen a dramatic decrease in the cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We are currently seeing a sharp decrease in our case rate as of week 32. So this particular graph shows the percent of positive tests that are reported in 1 and 2 day of tests done. And as we can see, there are variations in terms of how these test results are reported back to us. We have seen some good weeks and days when we were getting most of the tests back within 24 hours of our 1 day of testing. And a good number of these tests are returning back to us within 2 days of testing. But we have seen some variation over time. So from a health unit perspective, we investigated all our cases within 24 hours of receiving a positive lab results, despite the high number of cases that we have received more recently, and all those information is right there. And then in terms of number of cases that were reported to us, and in each of these days, our team initiated the contact case investigation within 24 hours of being reported to us. Looking at the regional and provincial rate, Windsor-Essex continues to be has the highest rate of COVID-19 cases in the province. For us locally, we experience a higher proportion of cases in the long-term care home and retirement home, which is now currently at 13% of our overall case, but at one point it was peaked at 42%, and that includes all the staff and residents. We are currently seeing an increase in the number of cases in the individuals in the agri-farm sector who are ill, which constitute roughly around 48% of our overall cases. So breaking down rates by each of the municipality, we can see that the highest rate was seen in Leamington and Kingsville, while the rest of the community shows a relatively lower number and comparable to each other from a COVID infection perspective. This map displays the rate per 1,000 residents by dissemination area. The areas with no colors are places where there haven't been any lab confirmed cases of COVID, for example, tested and diagnosed. As you can tell from the previous slide, in Leamington and Kingsville, the darker colors, blue and purple, indicates higher cases in these specific dissemination areas. Yellow or lighter version of yellow indicates low rates of COVID in these specific areas. Please note that this does not mean that these are where cases were infected rather than where they reside. Someone could have been exposed in outside of their DEA or dissemination area. For example, someone can live in the county and work in Windsor, or vice versa. Someone can live in Windsor and work in county. These cases are reported by their residence area where they live, and that's how it's reported back in this graph. This map zoomed down into the city of Windsor by the rate per 1,000 resident. Once again, areas with no color or where no lab confirmed cases were identified is shown in the map, and certain pockets we can see had higher rates across the city, where the other regions or other dissemination areas are not showing any of these cases at all. And majority of the areas are seeing low activity of COVID-19 in the community. This map looks at the currently active cases that the health unit is tracking per 1,000 population. And as we can see, the rates are higher in the areas of Kingsville and Leamington, but these are just the active cases that we are currently following up. It's an indicator of what is where these cases are, but again, it's not an indicator where the acquisition has happened. So just being mindful of where these cases are is just for our purposes to understand where these people are currently self-isolating. Looking again and zooming down on the city of Windsor, this is where the current active cases are located. And what we can see is again, the areas that do not have any color. That means right now there is no active case in those regions, but areas with yellow and then going further into blue to purple, that indicates that there are a high proportion of cases in that region. This figures look at the age breakdown by percentages for each of the municipality. The green and yellow orange bar indicate that there are a high number of young adults across each municipality. This is higher in Leamington and Kingsville due to the agri-farm sector workers who are of the working age, 20 to 39 years of age. And Tecumseh reported a higher proportion of older individuals, 80 plus, the black bars, whereas Amherstburg reported a higher number of younger people between 0 to 19 years of age, which is the dark blue bar in the graph. Looking further in age and sex distribution, overall we have seen more male cases compared to female, and this number is disproportionately high in males within the past 2 weeks. And overall, when we are comparing, those numbers are fairly comparable with the overall case distribution and comparing it with the last 2 weeks. Just breaking down the cases by each of the municipality, what we can see is Leamington overall cases. Leamington constituted 36% of our overall cases in the region. Windsor constitute 32% of the cases, Kingsville 24%, while the rest of the municipality is fairly at a lower level. Zooming it down into the last 30 days, the picture relatively stays the same with a high number of cases in Kingsville, 37%, Leamington 31%, Windsor 27%, while the rest of the municipalities have a low number of cases. Zooming it further down in the last 7 days, the picture continues the same in a similar way with some minor fluctuation. Leamington constituted 43% of our overall case, while Windsor 30% and Kingsville 22%, and many of the municipalities do not have any case at all. Breaking down by the occupation, in the last 7 days, most of the, or one-third of the workers, one-third of the cases are coming from the agri-farm sector, while roughly two-thirds of their cases are coming from non-agri-farm sector, and 3% of the cases are coming from the healthcare sector only. So here we are looking at how our cases acquired COVID. We see that earlier on it was imported to Windsor-Essex by travel, but looking just specifically on the last month or so, what we can see is the majority of these cases are coming from close contact, with a few cases coming from community transmission. However, in the more recent weeks, we have seen some travel-related cases as well. In the middle of the pandemic, around May and June, we have seen a significant decline in the travel-related cases, but with Windsor being the border town and with the travel happening with Michigan and our people going and working in Michigan, there are some cases that we are seeing now as a result of travel. The slides look at the exposure of agri-farm workers since the middle of May. While the majority of the cases have primarily acquired the illness through close contacts, we're also seeing instances where it's also acquired in the community. Among the non-agri-farm sector, as stated before, majority of these cases are coming from close contacts, whereas we are seeing some of the cases as a result of community transmission in the more recent time as well. Among healthcare workers, 78% of our healthcare workers are local that work here in Windsor, whereas 22% of the healthcare worker that we have reported worked in Michigan and were found to be COVID positive. With respect to underlying chronic health condition, majority of our cases, around 3/4 of our cases had no underlying medical condition, whereas 1/4 of our cases have some kind of underlying health condition or immunocompromised status, and that identifies the importance of developing the likelihood of developing severe complication associated with COVID. This particular graph is showing the cases with the symptomatic, asymptomatic individuals, and while majority of our cases continues to be symptomatic, we have got a significant number of asymptomatic workers, which were mainly from the agri-farm sector as a result of asymptomatic surveillance testing that happened, where we were unable to identify whether the cases were really active and infectious at that time of the testing, or they were infectious at that time. But based on those testing date, all of them were deemed as cases and are reported as such. Looking at the common symptom, cough, fever, headache continues to be the most common symptom for presenting with COVID. Please note that an individual can have more than one symptom, and these numbers may not add up. Looking at our health system capacity, what's happening at the hospitalization and ICU rate, we have seen that ICU cases have increased to levels seen in May. The red line indicates the 7-day moving average in the ICU, showing an increase in the last 7 days, but the trend is moving down. Hospitalization have fluctuated more so than the ICU. While we have seen a sharp decline in June, we are now seeing an increase in once again. And please note that these are all the hospitalization and ICU beds utilization based on a diagnosis of COVID-19. This particular graph takes factor into every hospital admission as an overall health system capacity, not only just for COVID, but an overall health system capacity. The orange line indicates the occupancy rate of all acute care beds. The threshold is to have the occupancy rate below 85%, which we are currently meeting. The signals that we have some flexibility in terms of taking in more COVID-19 cases in our healthcare system. The green and dark blue lines are for ICU capacity and ICU ventilator beds, respectively. For ICU capacity, we look at the overall ICU capacity and ventilator beds. While there is no established threshold, overall we aim to have less than 50% of our overall ICU beds occupied. Higher than this could lead to stress to the healthcare system if COVID-19 case rates increase in the community. Looking at how our cases are where they are, almost 85% of our cases are resolved, with only 11% are currently self-isolating. Unfortunately, we lost 3% of our cases to COVID-19, and we are seeing a minimal cases in the hospitals and the ICU system. Looking at the lives that are lost in Windsor-Essex, what we can see is overall more female died with COVID diagnosis compared to male. From an age distribution perspective, almost 70% of the deaths were involved in individuals who were 80 years and older. The youngest person died in our region was a man in his 20s. Looking at our case fatality rate, Windsor-Essex have a lower case fatality rate compared to the province of Ontario as an overall, as well as in the Ontario, comparing with just the fatality rate in the long-term care home system. The general direction, what we are moving in as a country is good. We are seeing some positive signs in Ontario. In Windsor-Essex, day-to-day variation fluctuated quite a lot in the recent weeks, but now we are seeing an improvement in the last 7 days, and it's comparable to the province and to the country as well. The most recent estimated mean R0 is 0.35, and this has decreased from last week. When the R0 is less than 1, every infection causes less than 1 new infection, signaling a decrease of virus activity in the community. When the R0 is greater than 1, that means each existing infection causes more than one new infection. Our R0 estimate varied greatly due to the influx of cases from the agri-farm sector. But in the recent days, we have seen a decrease across all cases in Windsor-Essex. The shaded area in this particular graph demonstrates the variation that we see in the R0, effective R0 in our region. So in summary, Windsor-Essex has seen a decline in the cases in the past week. The primary source of exposure continues to be close contact with a confirmed case. COVID-19 related hospitalization and ICU are starting to decrease once again, and we'd like to see it that way. The day-over-day doubling time in Windsor-Essex has fluctuated quite a bit in the last few weeks, but is now on par with the province and with the Canada. R0 effective value is currently sitting at 0.35, indicating a decrease in the transmission in Windsor-Essex, and we're hoping that this trend will continue. And thanks to all the residents for following all those public health measures to bring this numbers down for our region. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from CTV?
Good morning. I'm just curious, based on your numbers, you said, I'm just trying to wrap my head around everything you just had here, and plus the questions that I had, sorry. Given our shared border and based on the numbers, you say we're going in the right direction. We share a border with Chatham-Kent, and when I hear what's coming out of there, it sounds like they're having an influx of situations related to COVID. I asked at the beginning of the week what your conversations were with public health in Chatham-Kent, and I'll ask again today, when was your last briefing with what the situation is with our neighbors in Chatham-Kent?
Well, obviously, we are all responsible for our region, and we're taking all those decisions based in the best interest of our community. We talk when the issues transcends the regional borders or are the borders of where the health unit serves. And right now, our conversation is more focused on the issues and the cases among the low German-speaking population that we have seen across the southwest Ontario, and those conversations were focused on that group in particular.
So, case counts are based on where you live, not where you were infected.
That's the best evidence that we can use, and we try our best to identify a potential location where the transmission happened, and then take appropriate action accordingly. But as of now, whatever we are reporting, our cases are more focused in where we are in the region, and any travel related. Even if someone is reporting that they traveled to Toronto or somewhere else and then they got infected. So that information is there for us. And if there's any trend or any pattern that we identify, we do try to share that information back with the health unit. But so far, most of our cases, as we are reporting, they're all local. And then some of the travel that we are identifying is international travel.
Okay. So yes. Sorry, I don't want to drag this out, but CTV Windsor covers Windsor-Essex and Chatham-Kent, and I understand the health unit covers just Windsor-Essex. What do you say to any audience who gets two different opinions, at least from masks and the effectiveness of them, from two people in the same position of authority, given our shared regional border?
Well, I guess as we tailor our intervention as a physician, if I'm tailoring my intervention to my patient, so in this case, my patient is my region, and same as if any of the other public health units, they have their own patient and they have their own region. So they take into consideration everything before they make a recommendation in terms of what is the best for their population. So we're all doing what we feel is best for our community. And I would just say that, follow the direction of your doctor. And if you have any questions, please connect with your doctor to make sure that you're getting the right advice, considering all the factors that goes into any of these recommendations and decision making.
Thank you.
And any questions from Windsorite?
Just a few questions about the mean effective R0 slide. It was showing 0.35. That appears to be the lowest level we've ever been at since the beginning of this pandemic. I just had a question. Does that relate to unknown transmission, or does that involve close contact transmission when that number is calculated?
So the way R0 is calculated, and again, I can speak from what my expertise is, and I don't know if my epi can provide that comment. But generally speaking, so let's say if you have 100 people or 100 active cases, And then those 100 active cases, how many of these active cases are resulting in new cases? So let's say from that analogy, from those 100 cases, next day you have 200 cases. So that means that still one person is transmitting it to another person. So effectively, your R naught should become 1. But if that number goes down, so you have active cases, but then in the next cycle where you expect that these cases will be transmitted is less than that number, then the number or the mean effective R naught will tend to go down. So that's what we are seeing when you have a big spike in the number of cases where there are a lot of active cases, but if they are following all the public health measures and taking precautions, the cases that results from those active cases, if they go down, your R naught will go down. But with those cases, if it results in more cases, so that means secondary transmission is happening. If secondary transmission is happening, your R naught will continue to go up. So what we are seeing right now is if our R naught is going down, we're seeing a significant decline in the secondary transmission, and that's what the public health goal is. We try our best to reduce the secondary transmission and contain the disease. So that's when we are talking about public health intervention is focused on the identification of cases and containment of the case, virus containment. This is what we are doing. And when we are seeing that number go down, it's a measure that public health interventions are working and no new cases are showing up in the community. I don't know if it's helpful.
So with secondary transmission down and R naught at its lowest level, how do we keep it there? Going forward.
Well, that's exactly what we are doing is obviously the active cases, if we are containing them properly, and by that assumption, there are no cases that we are missing out in the community, that number will continue to go down. And but if it start to go back up, that means we have cases that are resulting in secondary transmission, and then it will start to go up again. So if we want to keep it that way, we just want to do the basics. Follow the public health measures, stay home when you're sick, get tested if you're sick. And if you are interacting with anyone, maintain your physical distance at all times. Use your cloth mask if physical distancing cannot be maintained. Reduce the number of close contacts that you have. And those are the basic measures that continues to happen. And as we continue to progress with the economy, with the regional reopening, those measures will continue to be the most effective measures if you want to keep that number down. The risk will increase because of more people out, more interactions, more activity, and that's why it will be more than ever necessary that we follow those measures.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. Just looking at the age breakdown by municipality, Amherstburg's overall cases, more than 10% are in people aged 0 to 19. Is there anything you can attribute to that number being so high?
Well, what we notice is, and again, some of that is anecdotal, and young people, they tend to congregate more and in groups, maybe, and we know no one is going to school. So they have a big friend circle. They want to hang out with them, and when they're hanging out, they are probably not maintaining physical distancing. Their numbers of close contacts increases, and if any of them develop any symptoms or get sick, it's easy to spread. So that's what's happening here in this particular situation. But we have seen similar scenarios in other jurisdictions where these younger people tend to congregate more, which led to the spread of the infection. So it's just a reminder that even in this time around, when you are meeting with people, always maintain your physical distancing with people who do not live in your household. And if you cannot maintain physical distancing, wear a cloth mask. And physical distancing by far is the most effective measure that we can do for for preventing the transmission. So just remember that even if you're young, even if you're old, even if you're middle-aged, that intervention is the most effective intervention that you can do to prevent COVID-19.
So anecdotally, most of these cases are in like young teenagers or preteens and not young children?
Yes, yeah. So it's more adults and teenager. That's where these cases are.
Okay, thank you, Dr. Ahmed.
Any questions from Blackburn?
Yeah, I guess just wondering, you've included the maps in this one, kind of broken down even as far as like neighborhoods. At the beginning of the pandemic, you didn't even really want to say like which municipalities we're coming from. How do we use these maps? Why are these effective? Why is it important to share this information now?
So a couple of reasons. Obviously, in the beginning, the case counts were so low, and even doesn't matter how we put it out there, there is a risk to individuals' privacy, and the message continues to be the same. So every time when we are putting out this message, it's for information purposes, recognizing that there's a lot of information that people need. Different information satisfies different individuals. For some, and I've heard this comment, it doesn't matter where it is, I will do whatever I want to do. For some, they want to know more and want to be prepared, even though they don't want to change any of their behavior. And some, maybe for a right or wrong reason, they only want to know where the cases are so that they want to take precautions in those areas, which is, again, it's counterintuitive to our messaging. So what we are trying to present is understanding that where these active cases are, which is understandable, we want to know as well that if there's any particular spot or in their particular high-risk population or neighborhood where any active intervention is needed, we can support that. So we need that for that purposes. The municipalities may need that information as well. So we're trying to present as much information as possible to support us and support our municipalities making those decisions, and doing that fine balance of presenting that information without putting any individual's privacy at risk. And whatever information we can show, we are showing it. And again, one more thing, that reminder, and thank you to all my epidemiological team. They are doing an amazing job. Given the size of our health unit, they are produced massive amount of data that is being appreciated by all levels of the government as well. The amount of work that they're doing, I think we should be appreciative of that. And I know there's been a lot of question that people have with respect to data. Respectfully, I would disagree. Our team has done an amazing job in terms of being open and transparent, and the amount of resources that we have. The data that we are able to produce now, we're sharing, and we are committed to share that information every day. Myself, Teresa, our team is available to answer all the questions that is helpful to us to support and fight this COVID pandemic, and we'll continue to do that. So to your question of these data, we are identifying all those needs. We are also understanding our community better, and we'll continue to share that information. But with the maps, it would just give you an indication of maybe a high-risk neighborhood, a high-risk intervention that you need to take, and we'll continue to provide that direction. But please be mindful, the risk is everywhere. And by no means, when we are presenting these maps, is an indication that you only take precautions when you are there. The precautions and every public health measure should be followed everywhere. Doesn't matter where you go.
Because as you've indicated, this is where these people live, not necessarily where they contracted the virus.
That is correct, yes.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, when it comes to, I'm looking at your summary page, the hospitals and ICUs, I believe Teresa said there is 10 currently in hospital right now. During the peak of the pandemic, what were our numbers like inside the hospital, not including the field hospital?
Yeah, I'm just trying to go back to the slide where we talked about the COVID cases. So if you can look at this particular slide, Rob, during the whole month of May, we have seen large number of cases of COVID-19 in the hospital population and also the ICU utilization. And then it got flatlined pretty much in the whole month of June and early July. And then we've seen some increase back in the mid of July onwards, and now it's trending backwards as well. So that's the indicator that we see that the severity of COVID-19, and also it signals the importance of people need to still think that this is real. This is causing hospitalization. This is leading to ICU admissions, and this is this is causing death. People are dying. So we cannot underestimate the impacts of COVID-19 in our community. So this graph basically just presents all of that information in front, that how these cases were hospitalized in ICU in our region.
Of the 10 cases right now in hospital, can you tell us how many are in ICU?
So 3 cases are in ICU, and the rest are in the acute care beds.
And sorry, just to follow up to that, of the 7 remaining, I know you can't get into all the because it's personnel and privacy issues, but how would you describe those 7 individuals, like their symptoms? How severe are they?
So at this point, I cannot comment on the specific details, they need hospital, basically. They need hospital care. That's why they're there. Anyone who doesn't need hospital care, they are discharged. So at this point, anyone who is there, they required close monitoring for various reasons, and all of that is being taken care of by the hospital.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Dr. Ahmed. How many personnel are on the health unit's epidemiological team?
So we have 2 epidemiologists, and then we have 1 data analyst that supports the 2 epidemiologists, and then we have our epi manager who oversees the entire program. So we have a small team, but again, that's why I was saying that the amount of data that we are producing, it goes beyond the typical capacity of a team like this. Some of the data that we are producing is comparable to the larger health units that have like a team of epidemiologists who are producing that data. Our team within our resources are doing an amazing job of creating all this data to support us, support me, Teresa, our team, and also sending this information back to the province to help them understand what's happening in Windsor-Essex as well. So I think I truly appreciate all the work that they do, and they continue to do an amazing job. So thank you to my team who is producing that report.
Yeah, it's definitely a lot of data over such a long period of time for 4 people on and off to be completing. So I can appreciate that. And then separately, are there any new big concerns that you have as we see a decline in cases?
So our concern continues to be the some of the what's coming, what's next. So I think as much as we continue to remind people that all these numbers, this is great. Like, thank you to the entire community that we're doing all this amazing job, but irrespective of where we are, make it a habit, make it a part of your life, what you're doing right now. I think that's what is needed. So we need to do that. The concern from a specific issue wise, it's obviously border. There are many more people that are traveling, commuting, going to work in Michigan, and also even locally, there are more people going to workplaces. And again, reminder that, if you can do your work from home, please do that. If you do not have that ability, when you are at your workplace, work with your employers. We have got several documents that we have produced for the employers to ensure and prevent the spread of COVID-19 at the workplace. So travel is through border is an issue, workplaces, and also the schools that will open. So those are the 3 things that is on our minds, and we're looking to it. We're trying our best to use the data, use the scientific evidence that is available through from various sources, work with the ministry, work with our partners to ensure that we have a better handle on what is to come. With strong support from all levels of government, we have got a good system in place for our agri-farm sector. That will continue to be a challenge for us because of their congregate living settings, and I don't see any short-term solution to that. So the employers I think they're also doing a great job in keeping their employees safe, keeping their workers safe, and identifying any symptomatic workers and bringing them for testing. And that's how we're still getting some of these positive results. So that's great. But those are the issues that will continue to exist in our community. And the best solution, like we have always said, is follow the public health measures. And if you're all doing it, we'll be in a great shape and we'll continue to move forward in the right direction.
Thank you, Doctor.
Any further questions from CTV?
Yes, how much can we attribute the low case counts this week to the lag in lab returns that you had mentioned?
The lab results we are getting is pretty quick. As I said, most of the results we are getting back in 48 hours. And again, the lab capacity has increased significantly over the time. In the beginning, there was a lot of delays. Right now, we're just getting all these positive results back in like 24 hours, maximum 48 hours. And so that's really a good indicator. And the lab, Teresa is continuing to participate with the lab people, and they're doing all the planning all the time, finding creative ways to support the health unit. And we also connect with them to make sure that, what we need from them. So all those conversations are really productive and helping us to get the results back quickly. So I wouldn't attribute it to any delay. I think it's just a reflection of what's happening in the community, which is a great sign. And again, I cannot stop appreciating the community doing the good work that we are doing right now, and we'll just need to continue to do that.
Thank you.
Any further questions from Windsorite?
No, thanks.
CBC?
No, thank you.
Blackburn?
No, thanks.
AM 800?
Dr. Ahmed, just a quick one here. For the outbreaks, when it comes to the workplaces, 13, when can we see the number drop? How does that work? And it's 2 or less cases that would have to be confirmed at those workplaces?
Well, usually just like we follow the same timeline. So if you have a case at the workplace or workplace have a worker that is identified as a COVID-19 case, so by the time when we remove this worker from the workplace, 14 days from that timeline, if you do not have any new case in that workplace, so then we can say that there was no transmission, happen at the workplace, and then we remove that workplace from the list. But what we are seeing is not when all these workplaces are identified as workplace outbreaks. It's not necessarily a risk and spread per se at the workplace. Majority of these workplaces have people who are living together, commuting together, and have reasons to spread it to one another outside of the workplace rather than at the workplace. So that's a good sign. But again, seeing that, we don't want to undermine or underestimate the risk that all these workplaces have. If they do not take all those precautions for COVID-19, it can easily explode into a major outbreak. So we want to continue to work with all these workplaces to have all these policies and procedures in place to prevent any transmission at the worksite.
Thank you. Have a great weekend.
Thank you.
Any further questions from Windsor Star?
No, thank you.
Okay, thank you, everyone.
Thank you.
Thank you.